the banker. Now, what about cancer screening? Well, because we know the increased risk of immunosuppression, we follow what's called the high-risk cancer screening guidelines from the American Cancer Society. And these are the guidelines that the Cancer Society puts out. Say if there's a family history of colon cancer or a family history of prostate cancer, perhaps your screening obviously would be more frequent. Well, because we know your immune systems are not normal and your risk is higher, we recommend screening. So we recommend things like colonoscopy every 5 years. After the age of 50, many of you had a colonoscopy before your transplant because we actually screen now before it, a change that we made about 5 or 6 years ago. For men, we're looking at prostate exams and the PSA, although there's a lot of controversy over the role of PSA right now, and you'll hear a lot of things on the internet. Because you guys are high risk, we made the decision that we're going to continue to screen. We may change that as we get more data. This is a moving target and controversial, but that's something. And then for women, mammograms, pap smear, GYN exam, and the GYN exam including an annual breast exam by a professional, as well as routine breast exams by you. We also check chest x-rays. We're looking for lymph nodes or any nodules or changes in the lungs, and then every visit, we're actually screening your blood tests. So we're looking at your white counts and your white cell counts and how they're distributed and all that, looking for changes. And we're also monitoring the immunosuppression drug levels. And over time, we're lowering those levels after the first year or so down so that we can kind of get by with the lowest levels possible. So those are things that we're working on. And this is the reason why we get an annual chest x-ray. We're going to tell the insurance company we're going to be getting it and fight with it a little bit. And it's, again, we're looking for any evidence of lymph nodes or nodules in the chest. Now, what can you do? Well, number one, you need to look at your skin and have anyone who lives with you who gets to see your skin, see if they see anything funny. And if they did, report that. You can't see your back, and there's lots of stuff you can't see. So you got to make sure that you're reporting any changes in moles and skin and all that kind of stuff. You'll be the most surveillance than we will. If we look at your skin, but we don't remember what it looked like last time, it doesn't really help us. And you need to be seen by a dermatologist at least annually. And many of the dermatologists, including the ones here, and I go to the same one that many of you go to, take pictures of your parts, and so that they can compare them over time. And I experienced that. It was an unusual experience, but an important one, so that if there's any change in these lesions, that they can be identified and removed, because easy to scoop it off than to have a problem. And then report any swollen lymph nodes, or blood in your skin, or anything else that you kind of notice that's abnormal back to the team so that we can evaluate that. And then, of course, testicular exam, breast exams, etc., that should be done all the time, monthly, both men and women, just to make sure that nothing is being missed. So those are all important things that you can do and have control of your own health.